To discuss progress, we're now joined from our Durban studio by KwaZulu-Natal's Health MEC, Dr. Sibongiseni Dhlomo. Thank you for your time, Dr. Dhlomo, this afternoon. I want to kick off by just getting an update from you on the situation currently in KZN with regards to the treatment and the waiting period specifically for treatment of patients in KZN with cancer.
Thank you very much, ma'am. Thanks for the opportunity. Maybe a good start is to start with the progress that we are making in early detections of cancers. We were excited last year, despite our challenges, that the Minister of Health, Dr. Aaron Motsoaledi, decided to come and launch the cancer campaign in KwaZulu-Natal. And when we did ask him what was the issue, he said, look, he was actually happy with the progress that we have made, and therefore he wants us to accelerate the program of early detection. We're excited that on that day, 1,110 women came forward to be screened, and we detected only 98 invasive cancer on them. Another group of men, about 230, came also for prostate cancer checkup. You'd recall that in the country we have 5 mainly cancers that are worrying us: cancer of the cervix, cancer of the breast, the cancer of the lung, colorectal cancer, and the prostate cancer. Now, we have made a progress because in the province we have given 45 facilities what we call LEDS machine. It's a large loop excision for transformation zone. It's a machine that can be used by an ordinary doctor like me to detect early cancer on the cervix and therefore bring those women early enough for treatment. That is very exciting. On the issue that maybe was making headlines last year, yes, there's no province now that has got as many machines as we have, the linear accelerator. And you'll recall, ma'am, this is taking care of the 20% of advanced lesions that are coming into our large hospitals. We have 2 linear accelerators at Eddington Hospital, 3 at Nkosi Albert Luthuli, 2 at Grace Hospital, and 1 at Queen Nandi. What was a major crisis last year, which we have since turned the corner, were the presence of oncologists. Yes, we don't have our own as yet at Nkosi Albert Luthuli, but there are 3 oncologists that are from the private sector. There's the 3 of ours that are at Addington Hospital, and therefore the 2 at the Grace Hospital. So that keeps us going. It has reduced significantly the waiting times, which used to be about 6 months, now reduced to 2 weeks, and 3 and 6 weeks for other cancers, thanks to the contribution that has come in largely. And these reports, we send them to the Human Rights Commission as much as we also send to the Minister. So we are happy with the progress that we are making, but we don't want to take our eyes out of the ball, because in that way we'll then miss that. We have actually been accelerating this through our Pillar Ma Cancer campaign, where we are saying it is going to be unacceptable for us to detect cancers too late in life. So rather, let's bring these women early enough, as early as 30, and screen them for cancer of the cervix.
Dr. Dhlomo, so I'm going to interrupt you there. Sorry, I do apologize for interrupting you. We're running slightly short on time, and one thing I do want to ask you just briefly is the problem that you had last year, the shortage of oncologists. Is that due to a shortage of practicing oncologists in KZN? Is it a location issue, or is that a training issue? Why are there not enough oncologists practicing in KZN?
It's a combination of both. As we speak in KwaZulu-Natal, just in Durban alone, there are 60 private oncologists. So we train, but whatever we do, everybody, most people go out into private sector. We have been getting only 1 coming in. That's why the 3 that are there, all of them have come in from that pool of about 5 that qualify in the whole country per year. Only 1 we get in. So we probably have to accelerate the number of that we train so that we can get more, because to a large extent, some of them still go on a private. But we do have our own now, the 3 in Durban. We have always never had a challenge in Grace Hospital in Pietermaritzburg. The other 3 at Nkosi Albert Luthuli, yes, they come from the private sector, and we continue to advertise, and we continue to ask for more if we could. And because the machines are now working, all that we are short of is our own, but we already have 3. We would want to have 3 more. Those that are in private sector are still helping us.
And we understand that often there is a very strong collaboration between doctors in the private sector and doctors at government health institutions. So it's great to see private sector doctors assisting with treatment of cancer patients in KZN. What I do want to ask, though, is the gathering information. Do we have strong procedures in place to gather information at a provincial level so that we can put together and collate the right kinds of information to strategically fight cancer across South Africa?
We're trying our best, ma'am. There is a cancer register. Of course, for it to exist nationally, we have to collate some information in the government hospitals. However, there's one area we are not aware of. Right now, quite a lot of other patients are being treated privately, but when they run short of their medical aids come July, August, a whole host of those patients will come into the public sector. We have not been aware, and therefore it became another burden that we don't want to discard, but it's just that it is a burden that private sector is not ready to deal with those patients as soon as they run out of their medical aids. Right now we are managing somewhere in September, October. We may just not be managing, but there's a whole host of patients who otherwise were being managed privately that we did not know, and now that we must cater for.
A last quick question quickly, Dr. Dlomo. Do patients receiving cancer treatment from government hospitals have alternative options in terms of treatment? We know that there are standardized treatment options and that alternative treatments are constantly being developed. Is there a variety or varied treatment options available to patients? Do we have the kind of financial capacity to offer that or not?
Look, if we had a financial capacity that was stronger than what we had, we probably will even have more specialists being available and more machines. We are managing to do what we can with the resources that we have. I know there's other developments in terms of modalities of better treatment and advanced treatment, but that's something that our specialists, oncology specialists, can talk to much more. They keep on updating us that they are actually trying all combinations, and we are looking forward to some of those developments. But for now, we think what we have gained in the province is to reduce waiting times in terms of waiting for the machine for those who need radiotherapy. For chemotherapy and the surgery, we have never had the challenge in regards to that part.
All right, thank you very much for that update. That was Dr. Sibongiseni Dlomo, the KZN Health MEC.